guess I've known from an early age that my mom was a nurse. It's just something that I always had a strong desire to do. I've tried different types of nursing and float pool. I worked ICU, but the ER is my home. It's just, I like thrill-seeking, fast pace. I'm a multitasker. I can't just stay still, you know? So the ER is where that's my calling.
We are a level 2 trauma center and we serve 17 counties. So all of those counties will come here to us, and really that's a pretty big population of people that we serve.
It is a very fast-paced emergency room, and there is some adrenaline rush to that, but it's definitely a family. We're in it together, and it's the feel of you're never alone. And it's just a really, really great place to work.
I just knew once I got in here that this was where I wanted to be. I loved the atmosphere. I really enjoyed the people that I work with. They just were so friendly and they were so willing to teach me.
I can't speak enough about the physicians that I work with. They're amazing. And I've worked for 17 years as a nurse in the emergency departments in Florida and in Georgia, and they're the best group I've ever worked with, and they're the reason I stay here.
Everybody is in there to help you. We get our IV started, our EKG done, the physician is at the bedside. You know that you are never alone. We all value being independent in our working, but knowing that if something is happening, I don't have to ask for help because it's already there. The TMH values is something that is very important to me in my personal life, to have integrity, to be compassionate, to be accountable. It goes back to the foundation of why I became a nurse, is because you're meeting people at their worst and doing what you can to make a difference in their lives, physically, emotionally, spiritually, you know, and taking the best care of them as if they were your own family member.
If I can go in there and just help them and hold their hand or give them water or, you know, just talk to them and explain the care that they're getting, explain what's going on, that makes me feel good. And a lot of times that's what patients want. They just want to know what's going on.
To see somebody look at you and say, thank you, your people took such good care of me. That's why I do my job.
I live an hour away, but it's worth the drive because I love working here. I mean, the people that I work with and the people that I work for treat me great. I get a lot of satisfaction out of working here.
Our leadership is so great at actively involving us in what's going on. I have to say, one of the things that I really enjoy about working in the ER is the communication. From the top down, we are always aware of what's going on.
I was always welcomed. I was always made to feel a part of the team. And that's what really excites me about TMH, is that you're part of the family, you're part of the team.
We've built our care team model with a group of nurses and paramedics and EMTs just to create a better efficiency in our workflow.
They really want to hear what we have to say. You know, they really want to hear on the front lines what will help make flow better, what will help make patient care better, what will help make your jobs better. And to me, that speaks volumes about TMH itself.
10 years ago, I was hired as a nurse extern on the peds floor, and there was a crazy critical patient, and later that day, I was in that patient's room, and the chief nursing officer came to the room and said, "Oh, thank you for taking part in this patient's care." And I said, "Oh, I was just an extern, and she said, "You are not just anything. You're part of this family, you're part of this patient's care, and this patient has depended on you today." And wow, that's a pretty amazing feeling. And that just transcends every part of TMH. You're part of the family. If something happens to you or your family, you're enveloped in this team.